You'll be aware at MTW we're doing lots of focused work to improve the flow of patients through our hospital. As part of that improvement work, we are particularly focusing on board rounds for the next 10 weeks. So we've agreed to produce a really short video that's going to outline very briefly what a board round is and what a good board round might look like. Patients' time is precious, we know that, and we know that the longer patients stay in hospital, they can become deconditioned. That's why a board round is really important. It allows us to agree actions that's going to make each day a green day opposed to a wasted day. Board rounds don't need to be complicated, only a minute per patient. There's only 4 questions you really need to ask yourselves at a board round. The first one is this patient medically fit? The second one is, when are we expecting this patient to leave hospital? The third one is, are there alternative pathways where this patient can be cared for outside of the acute setting? And lastly, and probably most importantly, is what is going to make today a green day? We want all our patients to have green days whenever we can.
Okay, so M. Bailey, medically fit for discharge, was admitted on the 17th of the 1st. EDD?
Yeah, no, he can go today. He came with a fall.
The morning board round is a brief meeting held every day of the week where possible. As you can see, it brings together the multidisciplinary team and is used to quickly assess the progress of our patient's journey. By the end of the board round, everyone should be clear on what actions are required to move the patient along their pathway towards a safe and effective discharge. A second afternoon board round should be undertaken where possible to ensure that actions agreed from the early board round have been completed. The early board round should take no longer than 30 minutes and the afternoon one 15 minutes. Remember, these meetings are not an MDT and don't need a full review of all the patient's care. The nurse in charge normally leads the board rounds along with a consultant or senior decision maker. Staff groups expected to be on the board rounds are a junior medical team, the nurse responsible for care delivery on that day, therapies, pharmacy, and a member of the integrated discharge team. Before the board round starts, the nurse in charge will update the team on the position of our hospital sites. This would include demand and flow information, as well as our escalation status. Take-home messages. Board round members should have a good knowledge of the patients they are discussing. Staff should be precise and succinct. A board round is not an MDT. Everybody should be focused and paying attention to the nurse in charge. Realistic expected discharge dates should be set for each patient. One size does not fit all. The important thing is that board rounds are happening on each of your wards. Here at MTW, our aim is to get the majority of our patients home for lunch on the day of their discharge. A successful board round will help facilitate this.
Board rounds are important to me because they identify where the patients are within their journey through Tunbridge Wells Hospital.
Board rounds are paramount to a patient's journey in the hospital. It gives us a chance to look at what's happening to the patient that day, and it brings the whole MDT together.
Board rounds are important because all staff members are together, and it also reduces the length of stay with the discussions.
Ward rounds are important because it gives us an idea to see the medically patients ready for discharge, to see who is requiring immediate medical attention, as well to identify any other issues on the ward.
From a flow coordinator's perspective, we need to know what a patient needs before they're discharged. If we know these needs beforehand, then we can try and get plans in place a lot earlier, which will then reduce the length of stay.
It's hugely important to run the ward as being a nurse in charge with the whole MDT and meeting and prioritize with the plan with the discharges and the patient length of stay in the ward.
So I think the board round's the kind of hub for the MDT. It's the start of the day, helps us all understand what's going on with the patients overnight and where we are in patients' journeys. It particularly helps us prioritise the patients that need to be seen first in the day and then optimise the flow of patients through the hospital so patients get home quicker and the sickest patients are seen first.
I hope you found this video beneficial. It's really important to remember that actually the board rounds are about our patients. A good board round improves the patient experience within our hospital. Thank you for watching.